I call this Board of Health meeting to order at 5:34. Please be advised that this meeting is being recorded. If we could all stand for the pledge. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Right. Did you catch your breath, Anna? All right. All righty. So, first item on the agenda is to introduce our new members. We'll start with you, sir.
How you doing?
Hi.
Tom Camp, 33 Charlton Road. Happy to be here and hope to make a difference.
Welcome.
Thank you.
Sandy Leacho, 38 West Dudley Road. Thank you to everybody that got me here, and I promise to work hard and try to help my community and be as supportive as I can to all the other members on the Board of Health. Thank you.
You met This is Heather. Did you meet Heather? Yes.
Not officially.
All right, Heather Arnold and Anna Durgan. Amanda Jacobson. Oh, Holmes. Excuse me. Tom Purcell. And you know me, Roberta Johnson. All right, welcome. So every election year, we have to reorganize the board. So we have 5 of us now, which is amazing. So now we have to reorganize chair, vice chair. Well, vice chair is new for us because there's 5 of us, and a clerk. So clerk, we've never had a clerk because we've had Amanda. So what are the rules for clerk? Are they taking notes?
Naming a position, they don't have the specific job.
Okay, because I know clerk on the other board that I'm on, we take notes because we don't have an administrative assistant.
Typically, a clerk will be the one that, if any document needs to be signed, unless it specifies the chairman, the clerk can represent the board for us. You all can designate that job to the clerk. Anything that really needs to be signed, permits, letters of request.
So when we have vouchers, those things,
You can have
we
the
need 2
clerk do
people
that.
for that anyhow, don't we?
3 now.
3 now. What? Our rules went up.
Yep.
All right, so this is where we are. So I will entertain a motion from the 4 of you,
Through the
whatever.
chair, I'd like to make a motion to nominate Roberta Johnson as chair.
All right, so we have a motion and a second. All in favor?
Aye.
Okay, I guess that passes for me to stay as the chair. Now, vice chair. Does anyone want to make a motion? So vice chair, I'm sorry. Was that you or you that said that?
That was me.
I'm sorry. Vice chair would step in if the chair is out, so you would be responsible for running the meeting. Okay.
I'd like to make a motion for Thomas to be vice chair.
Accept.
All right, I have a motion. Do I have a second?
Second.
All right, all in favor?
Aye.
Aye. All right, and clerk.
Can I volunteer? Or do you have to make a motion? Never mind.
You want to be clerk? I can make a motion.
If it pleases.
If I may, Madam Chair. Individuals can nominate themselves. They do not need a second to run for a seat or a position. So if she wants to name herself,
You
as
nominate
one,
yourself?
I'll make a motion.
she can do that. According to Robert's rules, that's one of the things we just did, so that your homework assignment for next meeting. We're
Through
going
the
to quiz
chair.
you on it.
Sure.
You are? Do we get a prize at the end? Because I will do it.
Through the chair.
Go.
But just
I
to
would like
give you
to-
the parameters of what
Okay.
Robert's Rules of Order say.
Okay.
I would like to make a motion to nominate Sandy as clerk.
I have a motion, and anyone
need
want
a
to second that?
I can second that.
All right, I have a motion and a second. All in favor? Aye. Fantastic. All right, moving on. Educational opportunities for members. Was that through you?
I'm sorry.
Educational opportunities for the members. Was that yours?
Well, that's one of the things we we're trying to do, because we have new members to the board, you may not be familiar with what's available to them, what their responsibilities are, what their avenues of jurisdiction are. That's what the educational process is. I'm not sure what was handed out to you. I think were the guidelines, those guidelines I handed out?
Yep.
Okay. Something you can peruse, you can see where boards of health,
Oh, yeah.
get in different communities, what they do. They don't have to do everything, but you have the opportunity to enforce, to regulate, to educate. And there's a lot of avenues to do it. One of the things I try to stress to all my, any of the other boards I've had or people that I've trained, you don't have to know everything. There's much, much more than you really can ever believe that you can know. All you have to do is know where to find it. And that's where the educational process will come in. It'll give you avenues to start to key in on all kinds of issues, everything from when you read through the guidelines for what boards of health can do, you'll be amazed at what you can regulate. You can regulate, you can enforce, you can teach. You can go in and you can vaccinate, you can evict people, you can do all kinds of stuff. Everything's got to be done the right way, that's all. And you're doing it to protect people and to protect people from themselves. So, good luck. Another homework assignment for you.
Thanks, Tom. So does the standard operating procedures falls under that opportunities that you talked about? So you don't want to break it down anymore? It's more for us to do?
It's
All
just
right.
more opportunities. The SOPs, standard operating procedures, those are what you already have in place. This is not meant to replace that or anything.
Right.
This is meant to provide more information so that if you want to augment it, you can.
Yeah, and what about so the open meeting law material, that's part of what you want us to review? Just because it's here, I want to make sure we touched on it.
Well, one of the things I can see that in the past, there have been members that have been uncomfortable because they don't know all of the rules or they don't know what they're allowed to do and what not to do. We're just trying to provide you some more
Right.
information and background for it. Not trying to dictate to you or tell you how to run your
No,
show.
it's super, it's definitely helpful, because I know when I started, there was only 3 of us. So when you speak with another member, you break an open meeting law rule. So it's important to know that. So it's good to have. All right, so we'll review that, and you can quiz us in August. How's that? All right. Anything else?
About open meeting?
Yeah.
Yes. On page 9 of the open meeting law, actually, I saw some stuff that I had no idea. Who is the ADA coordinator? Like, we don't have anybody listed on any of the agendas for any of the boards, and we're supposed to have a disabilities accommodations coordinator. And I was
Do we
wondering who
have
that
one?
was. There must be somebody. We
There
just
there
don't
is
know who
somebody
it
in the,
is yet.
yeah.
But
I'll-
we should definitely have, be aware of who that is, so if somebody contacts us and needs some sort of an accommodation, we need to know what kind
Yeah.
of accommodation we can, support and, where to send them.
Well, the standard is if we don't know what it is on our board, we defer it to the
Yeah.
corner office.
So the
That's all we do,
selectmen.
is go to the town manager.
Yeah, you can ask.
Okay.
Yeah,
He's,
that's fine.
he's supposed to have
Right.
all the answers, or the source to get all the answers.
Okay.
Was that it? Anything
Yes.
else? Yeah? How about you, Tom? Heather? Anna? This is so weird. I got 2 here and 2 here. Very excited. All right, so we have minutes for approval. So the 2 of you weren't with us at our prior to now, so you can't make a motion for those. So I'll just do I make a motion to approve the minutes for May 2025. June 10, 2025, and June 10, 2025 executive session that we will keep private because the investigation is ongoing.
I second the motion.
All right, we have a motion and a second, all in favor?
Aye.
Aye. Closed private, that's what I meant. All right, old business. Update on open health agent position and our interim agent. Tom has graciously extended to stay until we find somebody. The position has been posted. I do not know if there have been any candidates as of yet. This was just posted, I believe, Friday, excuse me.
The 11th.
Which
I
was
believe it
Friday,
the
right?
11th,
Yeah, Friday. So. Thank you.
Still here.
I know you are.
I know,
I'm
that's
very
exciting.
excited.
I said it's gonna be fun.
We are accepting applications, Tom.
Yeah,
Putting it out there.
But I think are we looking for full-time? You'd have
Yeah.
to stay full-time.
Oh, you can't do that.
He doesn't want to. He was our agent before.
I know.
Yeah.
I'm too old for that. I'm already collecting retirement. I can't do that.
All right, well, we tried.
Yeah.
We tried. We'll keep asking, okay? All right.
Sure.
All right. Update on AEDs and laptops. So I had brought this up, I don't know, December, January maybe. I had reached out to the group that we belong, the PHEP group, I think it's
FEP.
yeah, the emergency group.
Mhm.
And we were able to secure 2 AEDs and some laptops. Amanda, how many laptops did they give us?
One.
One, okay, one, to be used for emergency purposes. So the AED really came, so I was out in an establishment and there was an accident and a gentleman got hurt, and it just came to my mind that, my gosh, if he really got hurt as bad as the people inside the establishment said, we needed an AED, and we didn't have one. So this was at the upside. So my thought was, we will have to vote on donating one to them, but I would like to leave one with them because it's a central location on Schofield. There's a pizza restaurant, a liquor store, there's some businesses on the street. I think the library has their own, but they're the establishment that are open the latest. The only day they're not open is Monday. So that's what I wanted to do. Right now, the AEDs we're waiting for the adult and pediatric pads because the company that was supplying them, they had them on back order, so the cutoff was June 30th. So now PHEP, is that how
Yep.
they have to bring it to their July meeting to resubmit that for us, for Dudley, to get those pads. And once we get those pads, then I'd like to put it back on our agenda to vote to donate one. And I'm open for some ideas as to where we might want to drop the second one. We have one here, so we don't need one here. The schools have them. The library has it. So,
And FEP is giving us 2?
mhm. Yeah.
And 2 laptops.
No,
One
just one
laptop.
laptop. Yeah. Yeah. So just food for thought. We could revisit it once I find out some more about the pads, and we can kind of go from there. But I would hope that you would all agree that we could at least leave one on this part of town there at Upside, and then maybe somewhere up further on West Main. I don't know if the grocery store has one, and I don't know if Firebrands has one, but it's just kind of, it opened my eyes to be like, wow, if there was ever 911, an emergency while we're waiting for EMS, we should be doing something. So.
I want to check with EMS to see if they have any preference.
Yeah,
They would like to see.
yeah, sure.
Just as a recommendation.
Just put it out there, Joshua Park, is it Joshua Park behind?
Joshua Place.
Joshua Place.
Place, do they have one?
I think they might have
Yeah.
one, but
They may, but being a type
EMS
of.
has an inventory list also.
Okay.
They
Yeah.
should.
So maybe if they could share that with us, so we have an idea where they are.
One of the other things they've got to do is make sure that if we put it out there, if we're going to control it, then we're responsible for batteries and battery backup and all. If
What
you
about
want to,
training too, for the AEDs?
I'm sorry?
I'm sorry?
What about the training for the AEDs? Pretty
Yeah,
sure-
so why don't you just
I
have,
just-
I know you have to announce yourself for the public because they can
Sorry,
hear
John
someone.
Harden.
I know who you
I
are.
work in some commercial buildings and they all have the AEDs and there's
Right.
required training.
Right, so
So
I
that's-
have been talking with Chris and Kelly about this for a little while now because I think Chris was there the night that the accident happened. I can't remember, but I brought it up to them and a lot of the staff had been trained, but now there's no AED there, so they would have to get retrained. But that's not a problem because we have Chief Dean at the fire station who could provide a lesson, the classes, so, yeah. Thank you. Okay, next up, do you guys, sorry, do you have anything else that you guys want to add to that? No? All right. All right, next up is RJ's Auto Body. RJ, you are here. Would you like to come up?
How you doing? Roger Frappy at 8 Kennedy Drive. Just speaking with Tom earlier today, he's just looking for a couple of pieces of paper from me. And
Oh, thank you.
I supplied a letter to you guys earlier in the week, or last week, I think. Tom?
Yeah, there was a letter that's already been handed out to, well, these are the soundings?
Yeah, those are the, from the EP and,
Okay.
it didn't, they don't actually get a permit, it's just online, you know what I'm saying?
Yeah.
And that one, the number's up here for that. So, and my fire department ones and stuff like that.
Okay. This is the first that I've seen these, so if anything, if a decision's gotta be made because of these, then I'd suggest that you give me an opportunity to review them first.
Yes. I did look online. I'm very familiar with the DEP website. I could not find, there was no permits. Also on the EPA, there was no permits. File or directory was not found. Cannot see the proof of record. I
Cool.
felt short of calling anybody. I don't know if I'm allowed to call anybody, but I did try to look.
What's that for?
Excuse me?
What's that for?
For your permits. I tried to look them up because I didn't,
Well, I have many, many permits, so I'm just asking what is that?
the ones that you reference in your letter.
I just
Yeah.
handed it to him.
Okay. So you have the permits?
They don't actually print, I can't actually print out a permit. It's, if you go on their website, it says it's active, which I just handed him both of those numbers and the activeness to the permits.
Did they mail those to you?
They don't, no. It's just an online thing, I guess. Listen, I'm not too bright with computers and stuff like that, but if you look at it, it says status, active, and when I filed it or whatever, I don't. It says the site address and it says it's active.
So I don't know, Tom, I know Sandy has been to some of the meetings. I'm sure you've heard the discussions. I'm not sure, have you had a chance to get caught up? If not, while Tom's reading those. So we had some concerns over there about an odor. The stack outside, I guess, wasn't tall enough to, and where it stops, there's a lot of odor from the neighbors. So long story short, there's a cease and desist on it until Mr. Frappier could come back and produce these permits. He needed to go through DEP to get this done. They had gone out and we took it out of our hands. We did everything that we could, but until he fixed these issues through what they wanted him to do and got some permits, the cease and desist remained in place. So we had asked him to come back in June, but our meeting was canceled because it was the day after our election, so that's why.
Yep.
So here we are today.
Listen, so DEP never shut me down, just.
No, I know they didn't. We put the cease and desist on
Pat
it.
shut me down, yeah,
Right,
yeah, yeah,
yeah.
yeah. So
For painting only.
Yep.
He
Well,
could
for-
continue working as an auto body, but he could not do the spray booth until he met certain standards because of the odor.
So I've upgraded my systems, and I've been waiting for almost a year now for somebody to come back from the board to give me a smell test. Pat gave me a smell test, he wasn't satisfied, gave me the cease and desist, and I've been asking him for months prior to him leaving to come back and smell me, but he kept saying, do this, do that, do this. I did everything he asked me to do, and then at the end, he says I'm not qualified to smell me. So I need somebody to come do a smell test. Just to see where I'm at, you know what I'm saying?
So what do you think, Tom?
Well, as far as going down there to do a sniff test, and what it is, it's actually a subjective sniff test. If I can smell it, it doesn't pass. It's supposed to be odor-free. But he has an air scrubber that, on his paint booth, it's supposed to scrub the air before it gets discharged out of the paint booth. The problem is the location of the discharge of the flue. It's in a very inconvenient place. It appears as though. But, so what he has to do is improve the quality of the scrubber and the filters that are inside the flue and inside the paint booth, so that it eliminates the odors before it gets discharged. They're discharged under pressure or under a blower or a fan that pushes them out. And he's been waiting for a test. There's been several complaints in the meantime while he's modifying his system to accommodate the abutters. So at that point, there was no sense in doing a test. Now, he says that he's ready for a test, which is, like I say, subjective, but I will now make time to get down and to see if it passes. We have a kind of a unique situation. What we have is topographical positioning, and we also have chimney discharges. It appears as though everything is according to paperwork that I see here. He has two discharges. One is the waste oil furnace, and the second one is the paint booth. The waste oil furnace, it appears as though is a non-issue now at this point. I'm not saying it's going to stay that way forever. I can't promise that, but so the next step is now we'll get down, and now that he's got his record keeping in order, his small quantity use generator records and all, we can go and do a sniff test or an odor test. If it passes, then he can go. If he doesn't pass, then then he's not going to be issued the permit. That's all I can suggest at this point. We'll give him an opportunity to run through the program, and let's see what happens. It's either it smells or it doesn't.
Can I ask a question? So does he have to be spraying when you're doing your sniff test? Is that the way that works? So he
Yeah,
has
what
to
it-
spray, and then he uses the exhaust system that he's.
What we're gonna
the
do
new
is
stuff.
he'll spray paint something
Okay.
in my presence,
Okay.
and we'll be running the exhaust system at the same time. If it seems to work and it picks up all the odors before it gets discharged, there's not much else we can do. We just have to let it go until we get our first complaint. Get a complaint, cease and desist comes back out, and that's the end of it.
Where is the test being taken?
This facility is on, what number Schofield?
I'm aware of the facility and I'm
yeah.
aware of the property.
Yeah.
Where are you gonna do the sniff test? In the garage, outside the garage?
Yes.
At the resident's property?
All of them,
Okay.
all of the above. I'm not worried too much because I'm not worried about inside the garage.
No, I was just
I'm
making
more
sure that
interested
you're.
in the abutter's property and at the property line. Depending on what we have and what's going on, sometimes it's only at the property line, sometimes odors. My experience with facilities like this is odors, even if they migrate over the property line, it's enforceable. We have other steps that we can do. If for some reason he just can't seem to get it under control, he has the opportunity to hire an air quality engineer. And they could go in and start doing, they may be able to fabricate a filter system that'll take care of whatever he's got. I was successful with that with the 2 sites in Webster when I worked there. We went in, we had the air quality people go in and identify what the odor was, and then they put the appropriate filters in and eliminated the odor. They picked up the odor before it got discharged. That may be an easy resolution. It's not cheap. It's not cheap to do that, but if he really wants to stay there, he's gonna have to spend that kind of money, or relocate his business, one or the other. So, if you'd like, I'll get down and we'll run the test in the next 2 weeks.
Mm-hmm.
All right?
Yep.
See what my schedule is like. Okay?
Yeah.
Thank you.
Sound okay?
Yeah, works
So
for-
Tom will reach
And
out to you?
Yeah.
I'll let John know when we're doing it,
Yeah, definitely. Please and thank you.
so that he's aware of it, okay?
Thank you.
You're welcome. Any board have any other questions, comments about that? No?
No, as long as he's, okay with everything, then yeah.
I think we covered everything we need to on this.
Okay. I think I'm gonna go out of order for a second because I wanted to introduce the new animal inspector instead of having him sit through the rest of, unless you have somewhere to go, we can just have you come up, yeah. You guys don't mind? Have him come through and then,
Hi, I'm Ed Hart. I was made the animal inspector at the end of June, maybe. And I've been an animal inspector in Charlton, Oxford, Millbury. Now it's just Dudley, Charlton, and Oxford. I have experience with large animals, horses, cows. I'm also trained in large animal rescue. My job will be inspecting all the farms in town, plus the home chickens, which I guess nobody has actually been doing the hobby farms.
Yeah.
what's that?
The Harvey farms?
Hobby
People who
farms.
have chickens and all.
Oh, yeah, got it. Hobby, H-O, like a hobby.
Yeah.
Got it. I'm like, what's
Hobby
Harvey? Got it. It's been a long day. Got it.
And we'll be doing all the bite reports, rabies reports. So far, so good. I've had 1 bite incident and 1 40-day quarantine for a bite of unknown origin. So,
Are you gonna take care of like bats that get into people's homes, things like that? Bats that get into people's homes?
Bats.
Bats.
Bats, yeah.
I think you
No.
better move your micro, your.
Bats.
Oh, yeah.
Bats. If somebody
Bats falls
calls.
under animal control,
It does fall,
Okay.
so they can call you.
and we will be taking them out.
Do you send
They'll
them?
take them, call us, we'll come in, take it out of the house. And if you have no contact with it, we release it. If it's been in contact with people overnight, then we take it and send it to Tufts. And I'm sorry, my phone is ringing. Any questions?
Yes, so you're not going to just be dealing with cats and dogs. You're going to be dealing with any wildlife situation or domesticated
Farm animals,
farm animals?
yeah.
Okay. All right, that's good to know.
Mm-hmm.
We had a baby duck, a woodland, in my, outside my chicken coop, so I'll be seeing you. A couple weeks ago, it was the tiniest little thing, but it took us 4 hours to find a rescue and drive it to Connecticut. It is not easy to find a rescue these days to help, so it's great that we have you. Thank you.
And barn inspections begin in September, so I have a short list, but as I've been riding around town, I see a little bit more. Any questions?
How do we reach out to you? Well, the public, how will the public reach out to you? Through Amanda?
Or through this police department?
Dispatch? Okay.
I'm dispatched through the Webster
Yep.
dispatch system.
Do you run the Oxford, I guess, animal shelter? Are you?
I'm part-time animal control in Oxford too,
Okay.
besides the animal inspector.
Gotcha. So if you pick up a dog in Dudley, does it go to Oxford? Because I know it did in the past. Where does it go?
No,
Does it
they'll
go
stay
to-
here now.
Yeah,
Will
at
actually go.
the dump, I believe.
Yeah, because we do have one, but in the past, I know they've gone to Oxford. That's what.
Probably because we didn't have anybody for a while.
Yeah, because we were, as Oxford, we were covering at Point
Gotcha.
Stern
Okay, so it would go to.
that time.
Okay.
I am in the process of cleaning the new the shelter, getting it back up and running.
Okay, so.
I had my first dog in there this week.
Okay.
Luckily, she got fostered out and will be adopted by the people that are fostering her.
That's great.
We, the animal inspector and the animal control officer are actually, by statute, they're two separate people. Back a few years ago, we combined the both of them, and the Board of Selectmen approved it, the merging of the two jobs.
So he is both.
So he's both.
Yeah, some towns don't. They have a separate animal inspector and a separate animal control officer, which to me is foolish, but that's the
Well,
way it
That's
goes.
the way the state law is written, believe it or not. They are separate jobs,
Yeah,
but you can vote to merge the two, and that's what they did here. It's tough enough finding somebody that's got the heart and the ability to go out and do the job.
taking a lot of responsibility when
Yeah.
you're doing it. Everything is turned into the state. And then they check on our work too.
Right.
Great.
Any other questions? Thank you. It was very nice to meet you. Thank
Nice
you.
meeting
Thank you.
All right. All right, so next up is a CPR class. So, I think it was Sandy who had reached out about that. So I had Deb LaPlaca put it on Facebook, and I got a fairly large response, but out of the large response, only 9 people signed up. And it was at the fire station, it was free. Chief Dean did CPR, and those people who showed up were asking about first aid. So I think there's gonna be a class in August for the first aid portion. So I wanted to revisit it again to see if there was any interest, because there were a lot of people who said yes, but only, like I said, 9 signed up. So maybe in the fall, we'll revisit that. He's a little bit busy right now and he can't do it, but he said in the fall he would do it again. So I just wanted to thank him publicly for running that class. And then also for the first aid portion that he's gonna do. How was it? Was it bad? Was it fun?
Oh my God, we had a lot of fun. He's great.
Yeah.
He's great. He was awesome. And he was, willing to do a first aid class too, because some of us were like, hey, what about first aid? And he was just like, okay, so,
Yeah.
I mean, he was, and everybody that showed up, we all had a good time. Everybody was, it was a nice experience. So
Good.
thank you very much for setting that up.
Yeah,
It was
you're
great.
welcome, no problem. All right, so moving to the revised Body Works regulations. So I'll have Tom chat about that.
Okay, what I tried to do, we had a couple of sessions with a couple of applicants for the two sites that, or at least for one site, and had a great degree of difficulty trying to assemble the package, and communicate it all with them. And it seems as though that our regulations, they're a little cumbersome to deal with. Actually, they're very cumbersome to deal with. So what I did was before I went any further, I did a search for several communities throughout the Commonwealth. And I came up with one community that had a pretty well-organized set of regulations and an application process, and everything was really chronological. It was well-defined. It was easy to inspect. It was easy to review packages, and a lot of the subjectivity was taken out of it as far as defining what the different processes are and all. So I took the liberty of halting the process for now, and
That was me.
I took out, it was the town of Hanover, actually, was the one that came up as the best working set of rules. And if you'd like to review those, if you find that they still hit the target or what you're looking for, what we can do is I can modify those to say the town of Dudley, and there's plagiarism. There's no such thing as plagiarizing other people's rules and regulations. We can do that all we want, so I'm not worried about it being copyrighted or anything. I have a mechanism we can go in and change wherever it says the town of Hanover to the town of Dudley. I like the idea of the organization, the application process, and I also like the idea of, we want to see drawings, we want to see blueprints of what the place is going to look like. I think it's going to address, reading through it, it's going to give it a more clinical atmosphere than it is a luxurious atmosphere. So, that's my point. I went in and I looked, when you have nice bedspreads and wall hangings, it's an invitation, I think, it could be an invitation to disaster. It's an invitation to people's comments on what really goes on there. And we can, by strengthening the rules and clarifying them, we can make it easier to enforce.
Yeah.
Is the application online for the establishment, and is there a different application for the establishment and the practitioner?
Yes, there's two separate applications and two separate processes.
Okay.
There's for the practitioner, and then there's for the operator.
Okay.
Okay, so everything is really pretty clear. When you read through the regulations, like I say, I think it's worth looking at. And then if you approve it, we can take it up for the next meeting, or let us know ahead of time. We can go in and do the editing, and you'll have to go through two processes. You'll have to go through to rescind the old regulations that are already in place, and almost certain we have to advertise that?
Yeah, it's legal.
Okay,
Yeah.
so we have to advertise that before the next meeting,
Yep, 2 weeks.
2 weeks?
2 consecutive weeks.
And we can do it in the Telegram, or we can do it in the local,
You can do it in the
you
Times,
can do it in the Webster Times too, so.
and then you would have to send it to DEP, I believe, after it's reported through the town clerk.
I don't think we have to, we don't have, we send it to the AG, is what we do. The Attorney General, they clarify that it's legal what we did.
Okay.
That's the regulatory agency. We don't have, I don't think we have to send it to,
I'll forward you something,
okay,
because we had just done this in another town.
all right. If I have to notify somebody else,
Yeah.
I'm almost certain we gotta
We were
notify
under the
the
impression it
AG.
was AG.
But-
We were under the impression it was AG.
Yep.
But it comes to find out it was DEP.
DEP,
Yeah, it's weird. I'll send it to you.
under a public health.
Exactly,
And not
for
under
regulation,
Department
new
of Health?
regulation. Yeah.
Interesting.
I'll send it to you. It may
Yeah.
not be. It's just the way we went through it.
I guess that's what happens with the environmental guys.
Yeah.
Maybe on
They
this
move into
only.
the massage parlors.
Yes.
All right, so these are our existing ones that we adopted. So now we're gonna look at these.
Yeah,
And if
and
we,
the one that you have is in place now.
Yeah, this
That's
one.
That was from another community, that was
Yeah.
from.
Framingham, I think.
Framingham or
Yeah.
Natick or somewhere out that way.
That's fine. So if we wanna change to these,
I want to change, I'd like you to change to,
okay,
because it's easier to control, execute, and easier, I think, we're dealing with language barriers too.
Yep.
And we've got to have something that makes it very easy for them, for the applicant with no misinterpreting.
yeah.
We want it clear, every sentence very clear.
All right. So more homework for August.
You guys, I don't know if you're going to get vacation this year.
Jeez, Tom.
I need it on the beach.
You can do whatever you want, right, as long as you don't share it with anybody, yeah. All right, that's fine, so we will do our homework and we will touch base with you about that in August.
Okay.
All right, anything else, guys?
Oh, I have a question. I have
Yeah.
a quick question.
Yeah.
So when we have to put it in the newspaper, who pays for that? That's a budget thing, right?
We do.
Okay.
Mm-hmm.
Imagine
I passed
there's
I
a
passed the cup around.
Advertisement.
Everybody
line
throws
item
in
the budget.
$5.
No.
No. No. All right, discussion on the IMA agreement. So Dudley was part of the IMA agreement. We had left the group, which is the, I think it's intermunicipal agreement. I think that's how it, with Dudley, Oxford, Webster, Southbridge, Brimfield, Auburn, Worcester, I believe. I might be forgetting a town, and I apologize if I have. So we had left, we just felt that the group wasn't meeting our needs, so we left. And then we kind of learned from talking with other people what the group was really about, what the services really were. So we wanted to get back in, and it was a huge process. All the towns that are in this group had to bring it before their Board of Selectmen to get approved to let us back in. And the host town of this is Webster. So they were the last ones, and they had their meeting in June. And we have not been accepted back in. So with that, we are not in this intermunicipal group anymore. But part of what came with being in this fantastic group with all these other towns was the funds for our software. So we didn't budget for it when the time came, because we were very hopeful that we were going to get back in. So we're not in it anymore. I have talked with Jim Philbrook of Charlton. I apologize if I said Charlton was in it. They're not in it. They're in their own group. I'm hopeful that there will be room for them to take us into their group, but right now, there's not. So part of what the groups do also is they provide emergency supplies. So that's how we got the AED and the laptops if there's ever an emergency in the town. He's been speaking for us. I gave him permission, that was the letter I signed, to have Jim be part of that PEP group for us. So it's unfortunately that we weren't back in. I feel really badly about that because I really wanted to get back in, but we'll try again. We'll see if Charlton has room for us, but I just wanted to let you all know that it didn't work out. So anyways, any questions, anyone? No, all right. New business. All right, so review the Board of Health meeting, start time and calendar. I think that was you, huh?
It sure was.
What do you got?
I would like to talk about the start time.
Okay.
From 5:30 to 6 o'clock.
Nice. That's what I wanted to talk about.
And for several reasons. I mean, if you'd like my reason, I will tell you. I work municipality in a different town, and that is our late night. I gotta leave early regardless. I'd just rather not leave as early as I would for 5:30, so I would compromise a 6 o'clock time start. I think any later than that, it gets too late, especially if we have a big meeting.
Right.
So I mean, I wouldn't push it to 6:30, but, you know, I would split the difference with people.
All right. And the date is still good, Tuesdays, or?
The third Tuesday of every month, I won't change that. I got no problem with that.
Okay.
That doesn't bother me.
Okay.
It's just the time, you
Yeah.
know.
You okay?
You're the boss.
All right. I guess I am.
You have 24 hours a day.
All right, so I will make a motion to change the Board of Health meeting start time from 5:30 to 6 with the date remaining third Tuesday of the month.
I'll second that.
All right, I have a motion and a second. All in favor? Aye. All right, passes. So, Amanda, do you have a schedule of our meetings that you could give to Sandy and Tom? That way they'll have the dates for the rest of the year?
I do. I can email that to you tomorrow.
Yeah. And we'll just change the time to 6. All right. That was easy. Budget. All right, so we have our budget on our agenda that we have to discuss and vote for. Animal inspector, okay, Board of Health. Sure. Is the Board of Health training the classes that you have to take, or is that for us? What Board of Health training on here? What's Board of Health training fall under?
So that's for any of the board members or the health agent. So if you hire a health agent that needs to take some classes.
Classes? Okay. So what's not on here, or does it fall under our expenses, is the software? I don't know how much that costs.
$39.60.
Yeah, that's right there.
$3,960.
39.60.
Am I missing a page? Oh. Sorry, I was looking at this. Oh, Amanda, this font is small.
Just a quick question. I see the animal inspector stipend, and then the week of 7/5 and 7/12. Is that gonna continue now that we've hired somebody?
Yes, he started the new fiscal year, so he'll get paid that amount every week.
Okay. So the animal is out of the Board of Health,
Yeah.
out of their budget, okay.
I cannot
The
read that.
beach, do we always pay for the beach?
No.
We didn't.
So is that something we now going, but we weren't notified?
We were.
We were notified
We
of the
were.
beach.
Mhm.
We just, but it wasn't put in the budget?
It wasn't put in the budget before the budget meeting came out. What was that, April, I believe?
It was put in the budget request that was submitted.
Right.
But they just
Yeah.
upped our expenses from 3,000 to 5,000 to cover that.
Yeah, so we found out that the person was leaving in May. So Webster tests their lake, And when they tested the water at their lake, they did ours
For free.
for free. And that person retired. So we had, I don't know, a couple of months or maybe a month to find a new company. And we did, but it was kind of like, okay, we have to do it because the beach technically opens July 1, right? So that was another expense that now we have to come up with, just like the software. So we have to roll it into our budget, but we have an interim agent, but we don't have a full-time agent, so we technically have some funds from that we can pull with. And then when the year ends and then September, October comes and there might be some extra finances, they can pull it back into our account.
But until then, we're spending money we haven't been approved by the
Right.
voters to spend. And is that legal? Can we do that? I mean, I have no idea, so that's
Yeah.
why I'm asking.
Yeah.
We can do that,
Mhm.
and it's legal. Okay. That was my concern. That's it.
Yep. So hopefully, it'll all even itself out and we won't have to put it, in the budget but it's just unfortunately, I was very hopeful that it would work out that way. And part of the IMA thing, part of being in that group was you needed a public health nurse. So I worked really hard to get someone per diem to do that for us, who would handle all of our MAVEN, which is the reportables, the COVIDs, the rabies, the infectious diseases, the foodborne illnesses. We needed somebody to do that because prior to that person, it was me. I did that during COVID and I can't do that anymore. So I dropped it. Pat was doing it, but Tom can't do it because he doesn't work that many hours. So we had to pick and choose the things that we wanted him to do. So we have.
When we look for a new agent, that person has to have that.
We
Hopefully, right?
We
We're
meaning
looking
the
for-
previous board, me, Jen, and Heather, right? It was me, you, and Jen. We voted that we would put that in the, we put it in the health agent's job
But
description.
it doesn't have to be.
It does not have to be.
But it's cheaper
Because
for us
we
if we
didn't,
do.
right, because we didn't have a health nurse to do that.
Right.
So that's the other option. We could go back to the budget and put in for a health nurse. We have to go to town meeting for that, but it seemed to be more effective and efficient for us to have the agent do it when we have that person. Because it's it's just some classes that you have to take. Not just, it's a lot of work, but it seemed
But it
cheaper.
works out better for for us, for the taxpayers, for Dudley.
Yeah,
Shit.
it's okay.
That was bound to happen.
Any other questions you guys might have?
Beach signs. What was the beach signs?
The what?
Beach signs.
Where are they?
7, 12, 25, 413, beach signs. Caring Graphics, maybe?
Oh, we had to have signs made that the beach was closed.
Was closed.
Yeah,
Okay.
yeah. So whenever the beach is closed, we have to notify the public. Not everyone sees it on social
Yeah,
media,
right,
so we had to put the signs up. We thought we had signs, but somehow we don't.
Signs were all vandalized.
They were? Oh, that's a shame.
Vandalized or lost, one or the other.
Okay.
So I had to make a couple of temporary signs, and I ordered 2 permanent signs, or 2
Okay.
high-quality signs.
Mm-hmm.
And I have the bid, or the order and the invoice on them. It's gonna be a couple $100 for metal signposts and metal signs. They're 18 by 20, 18 by 12s. They're like parking signs, about that size. And all it simply says is beach open or beach closed. The highway superintendent and I are gonna find a way to have them stored at the beach in the bathhouse under lock and key. And then when they need to be put out, we can, I think we've got them, so they'll be less subject to vandalism, so we're gonna pay a little bit more attention to getting them in as quickly and getting them out, not leaving them out there, that's all. So that's it for the signs.
What's hazmat?
I know, I
A
saw
dollar.
it's $1.
What is that?
I don't know, that's been on the budget every year, so I don't know if that's something that we're just required to have.
Oh,
So, is it, anybody have sharps in town? The police collect sharps?
Mm-mm.
No.
Okay.
nope. Interesting. Ask Jen, I don't know what that is.
I have just one other question in regards
Yeah.
to the inspection software that you mentioned. Are we still able to use that software?
Yes. Yeah, you can.
If you guys vote to pay for it. So all the items on my tracking sheet,
Yep.
those are the ones that you guys have to sign for the bills tonight.
Oops.
So if you decide to pay for the inspection software to keep it, then that will bring, after all these bills are paid, that'll bring our expense account down to $216. And we
So-
still got $137 a week to pay for beach testing.
So the inspectional software was part of the IMA that we would need if we were in the IMA.
Well, we need it in general. So all our inspection, everything was paper and went
Okay.
to computer.
So just inspections. Just inspection is the software for inspectional purposes.
Right? Your food inspections, all your inspections are in the computer.
Well,
Food and
That
housing.
software, what?
It's food and housing.
in housing.
Nuisance?
So those are inspections, yeah.
Nothing in nuisance. Okay. Nuisance? Okay.
The only other thing that would be in there would be, it's under the building stuff is,
Pools. You could get the pool software, but we don't have any public pools in
Yeah.
Dudley.
right, we have no public pools.
No.
The septic systems and wells, those are all in the software now, right?
No.
No?
Not in this program that we've been using.
Oh, okay. that's
This is just
separate.
food and house
Oh,
inspections.
that's okay.
Yep,
The other
that's
one is the
different.
building, so we're not.
That's, yeah, that's
we're
the
not
permanent
responsible
portal.
for that. Okay.
So what happens,
Of-
if what happens when we vote yes to spend money that we're not, that we don't really have? What happens if we spend the money and then we're left with $216 in the budget and we have to test the beach every week? We don't even have 2 weeks worth of money
Right.
to test the beach, and it's middle of July. So what happens, like,
So then it just keeps going negative until September.
and then in
And then if
September-
if there's extra funding from other things that weren't spent, then it gets
like
put
the
back in.
healthy, like the salary?
Mm-hmm, yep,
And that's really the only thing we have to pull money from.
right.
The town has monies to pull from
Yeah.
if they have supplemental or rainy day funds and all of that.
Right, but come September, when everything has completed, I don't even know if that's the word, come September, October, when I believe is new budget time? I might even saying that
Start
wrong.
for the
Yeah, the new
following fiscal
What you
year.
get is a supplemental budget.
Yeah, so if they have extra funds that are left over from this previous year, then they will put it back into
But if they don't
ours.
have any funds for, what if they don't have funds for the Board of Health?
Then that's a chance that we take. That's where we've always been.
I feel like they pool it though, they definitely find it and they'll pull it
Yep.
from other
Yep.
resources, like if you pay, you know what I mean, if you watch the budget meetings and all that, they always end up moving money around and pulling it
Yeah.
from other locations. And then on top of that, we're not asking for a ton of money, So that's the other thing.
It's not to say that it's not going to happen, it could, but there's a chance that it could not, right? But there are ways for them to find it, like he said, rainy day, they have some funds set aside should things happen.
There's a process to get at it. It's not like you can just dip in and pay the bills. You gotta let everybody know, it's gotta go to town meeting
I know.
and all that to transfer.
Been to our town meetings lately when they're asking for money?
Been through enough of them.
So, the software
Yep.
price is $3,960.
Is that what it says?
Yep.
Yep.
Is that including tablets?
No.
Oh,
So is that another fee?
So we do now have to pay for the inspector's tablet, which is
Okay.
not a large amount, it's only $20 a month, $20.09, I think.
And is that including Wi-Fi outside the building?
And
Because you're gonna need to email these reports, or you're gonna do the
Yeah.
report, you know,
oh, that's right.
That's all through
I
Verizon.
don't
I would-
do, we do inspections on paper still. I would love to have a software, but there's a cost associated with it. This is a one-time fee, or is this an annual fee?
Of what?
Annual fee. And
The
the
software?
Software?
software is annual, and it did go up from last year.
Yep,
So,
and it's gonna go up every
Every
year.
year, yeah.
And who's the software through, if I may ask? Relevant?
yep,
Okay.
We're gonna be out of money in 1 week.
But you're going into this not knowing that we weren't gonna get let back into the IMA.
Yeah, I did not know that.
You know what I mean?
Yeah.
So.
I did not know that.
As a budget perspective, yeah, you have to look that, you have to, you know, allocate.
Yeah. Right. Who would have known?
Right. Yep, okay. I don't think I have anything else.
So if no one has anything else, then I will entertain a motion. If everyone wants to make a motion.
Just a comment on the vaccination program and all.
Does it go under the budget?
Oh, I'm sorry.
Oh, that's okay. Are you sleeping? Hold on.
Okay.
If it goes under it, then we'll talk. No? All right.
I will make a motion to accept the payment of total amount as listed.
so we
One,
need,
go ahead.
excuse me, sorry, so we need a motion to run the budget in the negative, because until October, when we can possibly.
Oh, I thought you needed a motion to accept payment.
No,
Oh.
But if we don't pay it,
Oh.
then he loses, then the iPad is not,
There, as of right now, there is no iPad, I don't believe.
no, there's an iPad, but if you don't pay for the software, then the inspector has to go back to doing everything by paper, which is fine, he can.
it
You
just takes more time.
It just takes more time, a lot more work for that inspector.
And we have a lot for an inspector to do.
We do.
But the iPad, we're under contract to pay that $20 a week, so we can't.
That's through Verizon, and that's only $20 a
Yeah.
month.
Oh, $20 a month,
Yeah.
not a week.
So that's not a major expense.
It's not major, it still needs to be in here.
It's just more the software that we're,
That has
And then if we
to
don't.
decide.
So we just need to somebody needs to make a motion to approve the running in the red until the October meeting,
Yeah,
something like that, right?
because it's your budget, so.
yeah. I'd rather not go back to paper, I mean, personally, just, I feel like if we can keep the software, I think it'd be worth it. Just have it all computerized right there.
Do you have any input, Tom? Any input on this?
Well, I I've seen governments that can run negative and recover. Again, when you do stuff like that, it can be disruptive, but that's what the financial people get paid for. If they absolutely told you you can't do it, they would have sent down a memo to you that.
All right.
Right.
Thank
But-
you for, go
Yeah,
ahead.
no,
But they
go ahead.
finish.
No,
They've already
I'm done.
told you that they can cover it somehow. They'll find a way to cover it.
Oh, they did.
Yeah,
Oh.
yes.
And then I feel like if we don't have a health agent, I mean, let's face it, we're saving some money there, and it's gonna take a few months to find one, hopefully.
Yeah, right. I think too, like, to speak about the software, you were with us before we had the software, right? And now we have it. So like, can you compare the two? Like, it must be a lot faster, a lot easier, right? And I know, I'm not saying we should go back to, I tossed it around. Should we just go back to paper to save the money? Because we don't really have it and we don't know what's gonna happen? But do you lose track of things once it becomes back to paper?
It's not like, I guess the thing is, they have it's an automated system, and believe me, I'm not in favor of either one. I just hate doing the reports, period, and it's not, I hate the computers as much as I hate writing, and I have as much difficulty as anybody learning new systems in the computers. So, I don't mind doing the paper. And it's not like we're saving paper or saving data and accumulating it and then try to print out a report. All it is data on each individual that we inspect. It appears as though it's pretty much the same thing. It's check off the boxes in the tablet, or check off the boxes on a piece of paper. My daughter tells me that it's actually easier doing the tablet than it is doing the paper. Tom's got experience at doing.
I'm doing paper, but in many years of being inspected in the food service business, I've seen these agents come in with tablets, and they can take pictures, and it's all part of the report.
Right.
I'm for it. I just
feel like it's less likely to get lost instead of, a pile of papers that, you know what I mean? Hey, let's face it, we're all human, things get lost, misplaced. I feel like on a tablet, in the computer system, it's you know where it is. Like, it's less likely to, yeah.
The sad thing is, a tablet and computerized programs like this, we don't own them. We'll only own the flash drive, and that's it. If we decide not to go, we're gonna get a box of flash drives, and that's gonna be our source of data. Oftentimes when we go do inspections, we're going back and looking at other inspections for the same site to compare with and all of that. Sometimes it's easier, but again, I'm just concerned about computerized programs that we buy, and we don't buy them. We don't own them. We only rent them. And if you don't pay the tab, you got nothing. That's the thing that's irksome about it.
So, if we agree to run in the red until October, how do these bills get, because we only have, there's going to be no money in that account to pay the monthly iPad. There's going to be no money left in the account soon to pay the beach testing. So where is that? I mean, these bills have to get paid. We're not just gonna have beach testing and we're gonna go to the town meeting with a bunch of, bills that need to be paid.
Right.
They have to be paid in the meantime. Where does that money come from? Who's paying that? Since if there's no money in this account, where is the money coming from? I'm new.
It's called cash flow.
I was just gonna say that.
It's coming out of cash flow. It's like anything else. You get a checking account, you're gonna pay the tab, but you got a car payment due next month, but you got the money already ahead of time for the car payment, you get the approval. So you're gonna borrow that money for the car payment, you're gonna spend it here, and hopefully you're gonna get enough revenues coming back in to pay the car payment when it comes back, when it comes around. It's called cash flow. Done all the time.
Yeah, just don't run my house.
Not a very good way to run business.
A lot of people do, but.
There's an awful lot of people that run that way, and a lot of businesses that run that way.
You know,
The
okay.
government runs that way. You just hope that you can catch up before the bill comes due. And that's why they have these rainy day funds. I forget the name of this. There's all kinds of funds that are out there. Some financial people, what they do is they budget in full-time for, let's say, the Board of Health agent, even though they know they're only gonna pay them part-time. They budget them out for $12 instead of $5. Instead of the $5, they're actually paying them. So they get $7 to play with. It's stuff that goes on all the time in all kinds of businesses. It's not just the running of government, it's everywhere.
Let's say we don't go with the software and we decide later, when we supposedly have the money, do we have to now pay, like, to restart the software? Do we have to pay, like, you know, or is it
It
just,
could be a fee, that would be something I'd have to research and call the company on.
yeah, there's usually a nice fat fee associated, so I was
There usually
wondering.
is for
Yeah,
some.
what it was, gotcha.
I don't know that you can usually do that, or turn the switch on and turn it off.
Nope, not without a
Decide to
fee.
pay- Decide to pay the $20 this month, and then next month.
Are we using this software
Yeah.
today?
I'm trying to learn how to use it.
Okay, so it's accessible to us.
Yes.
So that means we've started.
Yes.
Well, we've been, yeah. The previous agent used it, so, yeah.
So was this budgeted last fiscal year?
Yes, it was.
Just discussion-wise, I think maybe we look into this to budget this for next year.
What do you mean?
We need to look for, I mean, this is an annual cost. So if we accept it today and we decide to go in the red, we're gonna have to increase the budget for fiscal year 27 to accommodate this.
Right.
So this is where I'm, you know, is something can do in 2027? You know, or is it gonna get denied? You know what I mean? Is our budget, we're gonna put out a budget for X and it's gonna come back, sharpen your pencil, are we gonna lose it in a year anyways? I'm just thinking outside the box in the future.
I don't think so. Generally, we don't have issues with our budget, but again, we have $3,600 on here that we haven't had to pay, and now we do, so it's a terrible position to be in right now, that we have to like put this in here, figure out a way to continue doing what we've been doing, keep going negative, 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 and then September recuperate to pay off all these things, but then what happens for the following year? So right now, it's in the budget for our 2026 year. It's in there, but we have to look at next year for the year after.
It's not in the budget for 26, that's why it's gonna bring us into
Right here,
that's the budget we requested.
okay.
But it
So,
didn't
but
get
yeah,
approved.
so then when we
So
have to
it's-
go to the, yeah.
We don't
to the
see
meeting.
what was accepted.
That's on the other page. Nope, that's my tracking sheet. See that page right there?
Yeah.
That's what that was approved.
This is what we did in April, May? I don't
That's
remember.
for the new fiscal year. That's
Okay.
what's approved
This
for 26.
is what's approved for 26.
Yep. That's what we requested for 26.
Mhm. And this is what we need.
That's what we really need, but it didn't get all approved.
Right.
So if
because we didn't have the
I mean,
software
if you
on
didn't, if it wasn't approved for this year,
I can't read that, but.
that just goes to show what's gonna happen
It-
next year.
it might, yeah.
You know what I mean?
And that's why we have this discussion. I mean, we can certainly not vote on each piece, but I don't know how we would get some of those things done. Do we have, what, out of the Earth Day budget, $500, what do we pay with that?
That's all the supplies.
Okay. I thought the Green Valley or something.
They require you to get the supplies ahead of time, and then they'll reimburse you. You can apply to be reimbursed.
Okay. Have we done that yet?
We've done that every year.
Okay, and they usually do?
They usually do.
So when that happens, then that amount will go back into our budget.
What is the Board of Health travel?
Heather, you have to speak
Oh,
up. 'Cause
what
they-
is the Board of Health travel?
Miles.
So that's for like your health agent. They can put in for mileage.
This isn't something we can table?
The inspection software is due this month, the bill,
No.
so,
It sounds like we're on the hook for this.
so you can cancel it altogether and then we should be fine in our expense account. Or pay it and run in the negative.
And this one is for next year, right? The,
Fiscal year 26, which
and it's
ends
still not
this year.
this year, starting and ending.
So 7/1, June 30th.
I mean, that's what I tossed around, like, kind of putting the, where is it? God, that font is just killing me. The training. And software, sorry. Maybe we don't do the software because we can't afford to, but everything else seems to be okay. Then we have that buffer to pay for the rest of the things that we need to pay for. But how much is it gonna cost us to get signed up again? I mean, we could certainly find that out and then revisit that and tack that onto the next budget.
This could give us some time to do a little brainstorming too,
Yeah.
and see what else is out there. Do we have Adobe Pro? Can we make the 3-page form fillable on Adobe Pro and program and move them on to a iPad system? Nobody's stopping you there. Now you don't own it, but you don't pay for it.
You have a couple of IT people that,
You know,
Work for the
Adobe
town.
Pro can scan those
Maybe they could
generated
develop
and make them
something.
fillable.
I don't know how cumbersome it is to do it. Again, I have a tough enough time answering the phone, but,
I can let you know in
If it's on
30
paper,
30
do you
days
have
how
to-
it works out.
Like,
That's
put
what
in
we're
the computer
doing.
system after going
No.
back to paper? It
So
just
it's not
stays on
complete
paper.
you
yet.
can file it by address.
What, Adobe?
and just write
It'll
by type.
disappear.
I mean, it kind of
You know,
makes
but
sense.
it gets us
That's the way it
time.
was done on
Yeah.
Dole,
Right, so I think,
last year or two.
Yeah, I know. That's what worries me.
I mean, so if we
You know.
take
Yeah.
that 3,600 out, and then we'll be good for our expenses to continue to pay for the beach and anything else that might pop up.
Yes.
And then for 2027,
You could try to get.
Let's try to get
we'll
there.
do our
Yeah,
homework in the
absolutely.
meantime to figure out how much it will cost to get restarted up again. And-
I totally agree, but I feel like the beach, that's community.
We have to do
And
the
you know
beach.
something? The community needs something like that.
Yep.
You're gonna end up spending We were drowning in paper, we were drowning in files, we were drowning in,
Yeah.
we needed the space. So we eliminated an awful lot of
Yeah.
paper.
So,
Now what you're gonna be doing
The-
is drowning in costs
right,
to keep it all on a
Yep.
flash drive. Or a
so
hard copy, or whatever you want.
the inspector sheets, food safe for Dudley, are those your 3-page, double, your standard? So
We
does.
can do them for that, we can do them.
Yep, so you don't need those. I mean, yeah, you gotta pay for them, but after you do the report, you scan them. We have a hard drive. Does Board of Health have a drive?
Yes.
With every food and you just move them right in there.
Right.
But it also comes down to time, just because you're only part-time, so that's gonna add extra.
No, right. I'm
Like
thinking
the
outside
scanning
the
and
box
all
for the
that.
new full-time agent, because that's a full-time position, correct?
Mm-hmm.
Right.
Yes, it is.
So I just feel like that's, scanning it all is gonna add extra time, then we're gonna have to get, I don't know if the town has scanners or what, how you guys.
Right.
Yeah, that's not a problem.
Most of them are on the printer.
Printer, I have a scanner right in my office.
Yeah,
Just say
not printer,
printer or
copy machine.
Yeah.
Most of them have that option.
Scan to a
even your
thumb
cameras.
drive and,
Well, yeah,
Even if you just had a camera and did a snapshot of it all
yeah.
and
Oh, yeah.
file it that way.
Well, and you don't, do you have a town issued phone? No? Oh. So the agent does have one, so like to keep things, I'm gonna call it HIPAA compliant, because I don't know what it is for food and housing, but I would imagine that if they needed to take a snapshot of it, they would use their town one, then it all keeps it together, right? So, I mean, there are some options. I know we have to make this decision. I wish we could table it a little bit more, but I think that's my thought. And I like to hear more about what you say, so maybe we, as far as the software goes, we do a little bit of homework and we can bring some ideas to our next meeting so we can plan ahead for October or next year. We can't do it last minute.
Is there also a cheaper software option?
There could be, I mean, if you,
But this is what
Yeah.
Because I know my world, you could pick billions of them, so that's
Yeah.
why I'm like,
if
oh.
you could shop around this year and for next year, you find something that might be cheaper.
And then ask them to pay for it, and then if it's approved, then we get it.
Yeah.
And then it'll already be in the budget, and it'll be an expected,
Right.
and along with the beach testing, it'll be an expected expense, a reoccurring expected expense.
Yeah, we'll have to play around
Much
with
easier
it
to
too.
swallow than,
Yeah. Make sure it's like decent, play around with it and all that.
This is what we are. So we have to decide tonight. We have to make a motion on it tonight. If anyone's open for that.
so the motion would either be in the red or not in the
To
red.
keep the software and run in the red until October in hopes that we get more money. Or to cancel the software and take the year to come up with other options for next fiscal year. And maybe the new health agent will have some ideas for better options.
I'm wondering too if we could switch like mid-year, like let's say we do get a new health agent, they have something they like better, works better, more cost effective, like could we cancel this one and go with that one, you know what I'm saying? Like a
Right,
one-day-
right, but
Yeah.
if we don't
for
have the money
future.
now, how would we get the
Right.
money in, say, 3 months we have a new agent, or 2 months?
Yeah.
How will we pay for it then? So
Same
do
way.
we say we go in the red now? We would have to vote on that again.
Yeah.
So that's the other thing. So regardless of when, if we get a new
Yeah.
agent this year, which we hope we do, we will have no software for inspections, housing and food. It's all paper again. And we would have to wait until our next year to revisit that. Because if we're saying no now, that we're gonna vote that we're gonna take out that monies, we won't have it to say, oh, November, yay, we have somebody, we need to pay for the software, sorry, we have to wait until
Yeah,
we go
halfway,
throughout,
you're
we
gonna end up
can't.
paying the whole
We can't,
year
so
at
either,
6 months, you know,
we either do
I-
it now and put ourselves negative, and then September, or October, there's always funds to replenish that, or we say no and we have to wait a whole, is it a year, Amanda?
Yeah.
So we have to wait until next July again?
To the next budget season.
Okay, so,
Yeah, personally, I'd rather go into the red now, and that will give us some time to also do some research for potentially something else next year. You know what I mean? And then we could look into other systems or whatnot, but at least we have something in the meantime.
Would you, would FinCom give you, or your budget people give you any direction, which would be your easiest avenue right now, or your best avenue? Is there somebody at that level that would commit to helping you make a decision?
Who's
Offering you
FinCom?
opinion? What, do you have?
Finance.
Finance
oh,
committee.
no,
Do you have anybody on finance committee that you can talk to?
probably, but we need to know that tonight.
Yeah.
You have to have an
So
answer.
when
tonight.
I had a discussion with the TA, and I was told that come September, there are always funds available, and we should continue as planned, and it will get paid.
Is that a commitment from him?
Well,
Is that I'm just asking, because I don't know, I'm just saying, is that like, did it sound
today.
to you like it was a commitment, like?
It's today.
We could,
Yeah,
we could count on him to.
Today.
we could count on, so,
He's saying it today.
Today.
so we could count on.
We don't know what's gonna change in
Exactly.
municipality in 6
And
months.
neither- and neither
So
does
he's telling
he,
you
so-
today.
Right.
But like, when
confident.
it comes time, he could say no, because he
Correct.
didn't give it, because it's not a real commitment, it's.
Well, he could say no because the monies weren't there.
Right.
So that's for anybody, right? So yes, to answer your question, yes, it was a commitment that we should do it this way, and it will get paid, because historically, there has always been extra funds to pull from other places. They plan ahead that way. But I can't tell you that it will happen, because nobody knows. We've all gone to these meetings, we've all watched the town meetings, and things happen. So I don't know how to, I don't know, we're taking a chance. The safest thing for us to do would be to take out the software and go without it, because we know we're safe, and then plan down the road. So I don't know if that answers your question, but if you want to be conservative and safe, that's the way to do it. But we have to all agree on that.
So I think no matter what happens, there's gonna be 2 different sides.
Mm-hmm.
So, and we could go on all night. So I'm gonna make a motion to accept the inspectional software and go into the red.
I'm gonna second that.
We only need 2. Right? Yeah.
3, I
Duh.
thought we needed 3 now.
3.
You would need 3, 2/3.
Oh.
3 votes.
I'd make the motion to accept that too.
All right, so I have a motion and 2 yays. All in favor?
Aye.
I say nay. Sandy?
I'm saying nay to go in the red, correct, nay to the red.
Same for me. So
So,
2 nays and 3 yays.
okay.
All right. Page 2. Here you go. You want to lump in the beach testing, notification, and vaccine program into one? I think you did most of the beach testing.
I say get my bathing suit and my wetsuit.
Please, we'll put you on the poster.
Yeah.
Let's do it. What do you got for us?
Okay, we got, just as a kind of a hot tip reminder, we're coming into the West Nile virus and the EEE season. Vaccines, vaccinations, things to watch out for. We've got to watch the, also ticks is another issue right now that's going to start cropping up. If we go into the West Nile virus or the EEE, you're going to end up with water health activity and advising people, running advising programs, as well as potential of canceling town-run events, football games, soccer games, all of that. Limiting the time, they have to be done during daylight hours. So be prepared for that. You're coming into that season, number one. Number two, there's been a lot of discussion all the way up to the upper part of the state level for vaccination programs and immunization programs, and making sure that everybody's vaccinations are up to snuff. We're finding that things are starting to deteriorate a little bit, and measles now is starting to crop up as a regular event. I started a program between the two communities quite a few years ago to make sure through the school program, the school keeps records of all the vaccinated students. Although we can't make everybody get vaccinated, we identified everybody that was not vaccinated or was under-vaccinated. We took the initiative to send a letter back to the parents. We understand the different reasons why they don't vaccinate their children. Either they don't believe in it, they're afraid of for religious purposes, and
Medical.
and other medical. And then there's also the ones that, believe it or not, the parents don't have the time to take the children to get vaccinated. They're working. Everybody, you get single homes or single parent homes, or you've got both parents are working. So we took the initiative and we sent the announcement back and a description of what the students were deficient in. And we got an approval to use a generic letter of acceptance that the parent would allow the school or have the nurses, the school nurse, vaccinate their children without the parent being there. You can do that. You can get a permission to do that. You get them to sign off, send it back. You vaccinate the kids, the students at 11 or 12 o'clock. You do the 1 hour sit down for post-vaccination, and then put them on the school bus and send them home. They now become positive on the vaccinated numbers. There's still going to be people that are resistant to vaccines for whatever reason. So now it's much easier. We minimize the amount of students that potentially could be exposed if you have an outbreak of measles or mumps or whooping cough or anything that crops up. Now what you do is take the unvaccinated and under-vaccinated kids, and if the school will set the policy, those children get sent home for the quarantine period. They can't come back to school until the quarantine period is over. If there's a 10-day quarantine on measles, I'm not sure what the numbers are, but we just send them home, and they have the opportunity to do online education. It's not like students are not going to be educated. They can do online. And you can start controlling some of the diseases, or make sure that you don't have a runaway situation. So this is food for thought. If you think you might want to talk to the school about it and the school nurses program, I don't know how far, you would know because you work for them, how far developed they are to do that. They should be able to go in technically. We tried to get them so they could walk in, press a button for measles, and come up with the list of all the under-vaccinated and unvaccinated.
So I had thought of that too when I was the school nurse in town, and you have to get the vaccine somehow.
So we can get the vaccine.
So I hit a stone wall with that because I was not able to get that because It's been a while now since I've done middle school, but middle school, I don't remember which vaccine it is that was mandatory, that if kids didn't have it, then they set this exclusion time and kids can't come back to school. So my goal was no one should be excluded. If they don't have a medical or religious reason, the parents say no, then we'll vaccinate them. They can come to the Board of Health office. I'm a nurse. I can do it. I can get my friends, the other school nurses, and we'll do it. But there was some stone wall that I hit, and now I just don't remember. But the problem is, how you get the vaccine. Does the state come in to do it for them? Because I'm not sure if the school nurses will be able to do it. You pick a certain time, there's always something going on. There's always, there's a lunch, or there's a this, or there's a that, and where's that holding unit for all of those kids to sit? So,
Again, we had that thing, it worked out.
Yeah,
We
no.
ended up, we had, out of all the students in Webster, I think we ended up with 40 students that were not vaccinated.
yeah.
We had all the rest of them. We took care of like a couple of hundred.
Yeah.
With the new population we've seen moving around, and they're not dedicated to this school anymore, to go to school in this zone or this region.
Right.
They can come in from other towns, and we just don't want to lose that type of control. We have an opportunity to right some of the wrongs.
Yeah, and a lot of the parents are very receptive when you get to that point where it's like,
We're not going to get them all,
no, but
if we can knock out a whole bunch of them,
it's something to talk to Mr. LaMarche about.
I think that's the next step. Is
Yeah.
I remember speaking to Mr. LaMarche a few years ago, before you went to work for the school.
Yeah.
And it was very receptive with the Webster school system too.
Mm-hmm.
Unfortunately, that when I spoke to Mr. LaMarche, they didn't have enough on the records to be able to do that. With the new school year coming up, they could build the records in the program that we were looking for, but they didn't have access to it at that particular time. So with the new school year coming up and all of that, maybe this is a time to talk to Mr. LaMarche and see if all the vaccine records are up to snuff, and would he be willing to try a program? We're not forcing them.
No.
What we're doing is we're just making it available to the parents. We can get the vaccine. We got the vaccine. There was no problem. We get it through the state. So all we needed now was the vaccinators. And we have more than just the nurses. We have paramedics. We have EMS personnel. We have pharmacists that are out there. We have other medical professionals that can do it. So it can happen.
Yep, I think come August, when the nurses start getting the incoming students, they'll know.
Right.
And most of the nurses know, I did pre-K to 1, so I knew by the end of the school year, my kids that will go into the next school, I knew what they needed, and that nurse also knew. So we all know what's coming up. So we could have a discussion with them. It's July. We might not make it for August or September,
Well,
but we could
that's
certainly
right.
try.
If you go in and we discuss it with Mr. LaMarche now,
Yep.
lay the groundwork for it.
You have everything in writing that we could present to him, or maybe present something? It's in your head, but people like to see it on paper.
Yeah, we can try to do something, put it together, pull a package together.
Mm-hmm.
Like I said, I have to go back and do what I did before.
All
It may
right.
take a little bit of time, but it's something this is one of your jobs. It's a real value.
Mm-hmm.
And you look really good doing it, so.
Yeah. Any questions from any of you? Do you want to go over the beach testing? Are we all set?
Oh, the beach testing,
Yeah.
we do that just for information for all of you, that we do the beach testing. Our criteria, we have to do it once a week. We typically do it on Tuesday?
Mondays.
Monday. Do it typically on Monday, and if we come back with a positive hit that requires the beach being shut down, that gives us the opportunity to retest it, and maybe we can open it up for the weekend. Try to get the results back usually by Friday or late Thursday or early Friday, so that we can open the beach for the weekend. It's been paying off. It's pretty good. The beaches do recover in a matter of days. They can. So that's not a non-issue. There's a couple of weather patterns that one is copious amounts of rain, excessive rain. What it does is it roils the water and the bacteria count goes up. The other extreme is drought. It causes
Both ends.
right. But like I say, usually all it takes is a little bit of mild weather for a day or two, and it'll recover right away. Otherwise, what you'll end up with is sore throats and earaches and pink eye and everything else. So
We test like every week up until.
we test every week
Until a
until
certain-
Labor Day.
Until Labor Day.
The beach seasons are open. We usually try to do Memorial Day weekend or the week before Memorial Day, and then we try to make sure we're covered till Labor Day. That's the attempt. We hire out, who are we using? Microsoft?
Microvac.
Microvac. We used to use Town of Webster, but the service is no longer available.
Yep. All right. We are on to member issues. So if there are any issues any of you want to discuss for our next meeting, email it to Amanda. Amanda, what do you do, 2 weeks or a week before agendas due?
The week before.
Okay. We're on other business. I don't think we have anything.
2 weeks, you said?
1.
1 week?
Yep. And we're on citizens' comments. Anyone from the audience have anything that they want to come up and talk about?
I'd like to.
All right.
On Hardin, 5 Office Hill Road, Dudley. Welcome to the new board members. Painfully so, this has been going on. I have problems with RJ's Auto Body. It's been going on since July of 2022. Try not to rehash anything. Roberta's been over this quite a few times. However, question to Tom. Did RJ give you the, you were asking, you're telling him he needed a site certificate from DEP. Was that in the literature he gave you?
Yes, there was something, again, I didn't have time to study it,
Well-
but it came out of the DEP portal.
And whose name was on that? Was it Michelle Demare?
Good question. Like I said, I haven't really had time to digest it all.
Okay, well, all right, I didn't mean to put you on the spot. We can,
And,
I can-
and like I said, I'm familiar with Michelle. Michelle and I know each other, and I'm looking at, he's got some paperwork here, but not everything that I'm looking for or would like to see yet. We're looking at, and it's really not fair to
Okay.
discuss it.
That's fine.
without
I
you
don't-
being-
I don't think you
Okay,
need-
I wish he stayed, that would have been
Yeah.
great.
But that's what my plan is, to go and sit with them and talk with it. I'm gonna work out a plan for doing the sniff tests, and if it becomes an issue or inconvenience.
See, I have a problem with that, but,
Well, again,
only
we know that-
because-
We know that part of it is a subjective, there's a subjectivity, but if we have to, we have the opportunity, I have the opportunity of having them now hire a professional to go in and do air quality.
well, that's one thing I wanted to bring up with the Board of Health. I don't think any action should be taken on any new materials from RJ that he just submitted, because right from the jump, he's been in violation of the Board of Health order on him getting a peer review. You guys all bought, new members haven't, but the Board of Health already voted on a peer review. I think it was a year or 2 years ago, and every time he's come here, he hasn't had the peer review. I don't think that's very,
Well,
you would actually have to vote to change the peer review requirement. But to date, he hasn't given a peer review. And that's why the peer review was ordered, because he's been stonewalling the Board of Health every time he came here and had nothing that he was told to get, as far as to try to make sense of the situation. Also, the May 20th, 2025 meeting, timestamp 3250 to 4635, I had brought up the fact that the town council said there'll be no further discussions if you violate any of this. We're not going to warn you again, and that went by the board. And then at 3250 and 4650, I said I wasn't happy that, he was just being allowed to do work in his shop. And you said, well, let's give him one more chance. Well, on July 3rd, my wife was in the pool and she could smell paint. I called Tom. From what I gathered, Tom went and responded. Do you have an inspection report from that? Did you find that he was spraying?
I have a report.
So the next step.
I wrote a report. Number one, I did write a report. He did admit to it, and I told him, don't do it again. He said, I have paperwork. I said, we're not dealing with you having paperwork. That just because you have that doesn't mean that you can go out in the field and do that.
So this was like the second time he's done that. Remember when I forget the lady's name? Remember when he was spraying right before the first time I came here? He was spraying and she flipped out at him? Camellia? It was a Camille?
Sir, I don't remember yesterday.
I
Camille's been gone
admonished
for
the
a
new Board
long
of Health
time.
members to look at the Board of Health on YouTube, beginning on June 16th of last year.
She wasn't with us last year.
I'll put
Yeah,
together for the
that was-
new members. I'll give you,
Camille's been
I'd
gone
love
for a
for you
while.
guys to watch
Okay.
what's transpired.
Very
over this
aware,
thing.
I've watched him.
So I hope you can understand my total
From today
dissatisfaction.
forward, absolutely. I'm not disagreeing with you.
Okay.
But it looks like he's working.
I mean, he's up
He's
in
got
the
some
papers.
documentation.
But the last thing was, Roberta said, the last meeting, she said, if he does it again, we're gonna go to court. Now he's got another chance, he doesn't do his peer review, and now they gotta do a smell test. And by the way, Jim Philbrook went out there when Pat was put on leave or his health situation from another town, and he noted that they didn't have automatic fire suppression in his spray booth, which is a requirement in Massachusetts. Well, the fire department chief gave him a year's exemption, just out of the blue.
We don't have control of that, though. I mean, we've gone through this so many times. We really have, and I empathize. I feel bad.
Do I have to get the state fire marshal and the
all-
building inspector, state building inspector out here?
If you want to, sir, but I mean, it all goes back to, I've called RJ out on it, and he's not here, but he did what he did without doing it correctly. So now we have a hot mess, okay? Camille did what she did. I don't remember seeing you ever until you came forward now. So I don't remember, okay, you coming to our meetings talking about any of this. Maybe you talked privately with Camille, but I don't. I'm sure I'm on the video, but I just have no recollection at all. Okay, I'm a busy person in my life during the time when Camille was with me. Then Camille left, and we had nobody for a long time. I've said this before. We had nobody for a long time to address your complaints, your concerns. We had nobody. The three of us, well, sorry, no, not even. I don't even have any of those members left.
Oh, I know.
There were three of us on this board who are volunteers who take the direction from a health agent. Camille left us. We had nobody. And I do remember looking at my agenda going, when Jen Canoyer would say, oh, we're going to table that, table that, table that. And we had record time meetings because we had no health agent to direct us on what we needed to do. So then Pat came in and Pat dealt with it. But then Pat left and then Jim came. And then Pat never came back and Tom got involved. And you know, during that time when it was in that interim when we had nobody to help us when Pat was gone, I reached out to town council for advice, and this is what he told me to do. And then the heavens opened and we got my angel here, came back, and he helped me. And we didn't need to go to court because, as you heard, we don't have a whole lot of money. So the Board of Health wasn't gonna go to court because we didn't have the money to do so. And we decided that we were gonna do this. And Tom actually had some great input. So I understand you're frustrated, but I don't know what else to do. I really don't. I think that plan that we had for him was to correct all of those things, and Tom's gonna go back out there and hopefully it'll get better. Hopefully the smell will be gone.
For 4 years, I don't think I've been treated fairly. I think I've been totally.
Well, I didn't sit in this seat in those 4 years where you were, so.
Been here 9 years, he said.
This is my second year as the chair. So, oh, sorry, this is my third year as the chair. So these board members are here to help me on this board. And yes, the chair is the voice of the board, but I wasn't in that role. And I'm not saying that I'm beating up the prior chair. That's not what I'm saying at all. I can't go, just like he just said, today forward, he understands, but what happened when I wasn't the chair, sir, I don't remember. I can't speak to that, and it's in the past. So I think we made a fair decision that Tom's gonna go out there and that we hope that he made the corrections. Because ideally, we want you to enjoy your home and we want RJ to succeed in town.
I feel like I'm just up against a brick wall.
What is it that you want me to do? You want me
I
to?
want his stacks removed. I want his spray booth removed. I shouldn't have to lay awake or at any moment be inconvenienced by the nuisance.
How do you know that
of
the stack
spray.
isn't corrected?
Because he was just got caught spraying the other day, on July 3rd. If he went down and saw him spraying and he just said he admitted it, that was supposed to be the end game.
Yep.
Tell him, just stop, you can't do it. I mean, that place, for the new members, the place was never permitted at all. There's a change of use, there's no sprinkler, the stack doesn't meet the height requirements, the wind blows in my direction constantly, and it's going on and on and on, and it's one more chance.
But
And I
the
kept
stack-
trying to be
yeah,
fair.
right.
But the stack for the spray booth, it's supposed to be 35 feet high, but the town doesn't, you can't even do that due to zoning requirements. If this was done properly, he would have never started his business.
Correct.
So.
Correct.
So now I gotta live it because nobody can.
But if maybe the stack is incorrect, however, perhaps if the system that he installed inside is correct,
Well, that's
then
what
we
the
have a
peer
win-win.
review was for. It was
Okay.
supposed to be an engineered system that would
I don't know what
alleviate
happened with that.
Do it. And so-
No, I don't know why it fell through the cracks. I'm not really sure.
But it's still on, it still was voted on, and it's still in force, it should be still in force, that he needs to provide a peer review. And that's gonna solve it. That's why you guys voted
I
on
don't
the
think
peer
a
review.
peer review is gonna solve it. That, yeah.
It would tell
Go
him,
ahead,
I've got a question.
please.
What's a peer review?
I think that's what I was gonna try to explain. I
I'm trying to
think,
find out what a peer review really is. Is it a bunch of spray booth guys that go down there and witness his operation?
Yeah.
Or is it a bunch of neighbors that are going over there to?
I know you weren't here to vote on that, Tom, but that's what they
Again,
voted on.
Again, I keep hearing peer review, peer review, peer review.
right.
What is a peer review? A peer review is an equal subjective people that are gonna evaluate whether he's right or wrong.
And determine how to
If I bring a
correct the
bunch of spray
situation.
booth guys down there and say, and they're gonna say, well, we deal with this all day long, this is fine, versus bring a bunch of neighbors and abutters like you that live next door and put up with it. Is it peer review for him, or is
I'm
it
pretty
peer-
sure a peer review would be from
Deep.
professional engineers that would be able to determine the correct methods to proceed to stop the situation and smells from creating a
That's not peer
nuisance
review.
on my, yeah,
That's
that's,
not peer
from
review,
DP?
that's a professional
Yes.
evaluation.
He was
and
supposed to
believe it or
reach out
not,
to
not
them
that
and they
you
were gonna
really have
send
to know
somebody
what
down.
my job is.
He's not here though, it's not fair to keep talking about it.
Springfield, I think.
That's my next step.
I think
It's not
somebody did go
cheap
out.
to do it.
but he was ordered to do it though. And he never did. You guys voted on it.
I think he did.
But it's like $2,000.
This,
Oh.
we're not supposed to have.
Yeah, so he's not here, so I think I am all done. I am all done with that. He's not here. I don't wanna keep
Okay.
talking
I
about
didn't
it.
realize there was regulations on talking without him here, but,
Well, I mean,
Courtesy. It's called
it's,
courtesy.
what if you weren't here, right? So I just.
no, I get it.
I get it. So
get it,
I
so.
think it's a touchy situation, subject, I understand, but I think we're all done for the night with that, for tonight. I don't know what else, how else to,
Okay,
okay?
thank you.
Yeah,
Thanks for listening anyways. Thank you.
you're welcome. All right, guys, I will entertain a motion. Sorry, either of you have anything? No, all right. Guys?
I'll make a motion
All
to
right.
adjourn.
I have a motion, do I have a second?
Second.
All right, all in favor?
Aye.
Aye.
Meeting adjourned at 19:31, 7:30.